It's the worst philosophies.
All right, thanks so much to all for your patience and flexibility. This past 24 hours, I think this psychologist has had numerous panic attacks. Trying to get here, presentation's not working, but here we go. So everyone send good thoughts or vibes that this presentation continues to stay on the screen a little bit. So like Melanie so kindly introduced, so I'm Aimee Thompson. I'm a psychologist that works with the program at Cincinnati Children's. I have been at Children's for 3 years and involved in that program pretty much the whole time I was there, thanks to Dr. Adams, who got psychology pretty involved in that multidisciplinary clinic. So this is my second conference. I did include kind of some general information that we covered a few years ago, but I also changed it up quite a bit, hoping that it would be more kind of relevant and interesting to you all in the room today. So an overview of what we're going to go through. So kind of a review of the 2014 meeting. What's the role of psychology in treating combined vascular anomalies? Deficits versus strengths conceptualizations, and then what do we do with all of this information? How do we apply it to kind of what's going on in real life? So the title of my presentation is Psychosocial Considerations, the Elephant in the Room. So my big question is, why is this the elephant in the room, right? So I challenge all of you all. I know that yesterday was medical talks. I know that Linda just did a great presentation on lymphedema. Now we're going to kind of switch to the psychosocial aspects of things a little bit. So I challenge you all to sort of take off your medical hat, put on your overall mental and emotional health hat, so that we can sort of think these things through. We do know that there has been a big push to move to more holistic health, right? So really looking at the mind-body connection and how they interplay together to impact each. We also have lots of data in the medical literature that involvement of psychology or behavioral medicine in medical clinics drastically reduces medical costs. So we see fewer hospitalizations, fewer doctor visits, and just less overall healthcare utilization when there is psychology involvement in these medical clinics. So for those of you that were not at our meeting 2 years ago, I used this pretty cool app where I was asking some questions and people in the audience were able to use their cell phones to respond. And they showed up on the screen anonymously. But it was really interesting, so I wanted to start our first two, I wanted to start by kind of reviewing 2 of the questions I asked. So this slide right here just shows some of the responses on ways that KT has impacted my life. So we see finding clothes, parenting worries, pain, finding shoes, not knowing and doctors not always being able to help. There's financial concerns up there, job options, lack of activity, telling friends I have to sit down, right, were some of the things that were up there. I'm interested to know in the room, who is a patient? Okay, wow, lots, good, okay. So then the rest of you all are family or caregivers, I assume, correct? Okay. So another question I had asked was, if you did have access to a psychologist, what do you believe a psychologist would be helpful with? So this is a little different. It's a word cloud, meaning the words that are largest are the words that were most commonly thrown in there, most frequently used. So clearly acceptance was a very, very common response. And we are going to talk about that a little later in the presentation. Anxiety and self-confidence also were kind of heavy hitters on that response. So I thought it would be really interesting to talk about, and actually really important to talk about, so what's the difference between clinical psychology and pediatric psychology? I'm going to put a little caveat out there. I have a hard time with the word pediatric psychology. I'm identified as a pediatric psychologist, but honestly, most of the patients that I work with are what we consider adolescents and young adults, so that 15 through 39 age range. Many programs have started treating older patients, and our program is one that does. So I am lucky enough to be able to work with that older population. So for me, pediatric psychology, I just want you to think of it more as health psychology. So we all know clinical psychology, right? Your common concerns are depression, anxiety, adjustment concerns, disruptive behavior. Pediatric psychology or health psychology is all of that, but there's also a really specific and persistent focus on adherence to the medical condition and the regimen. So taking our pills, wearing our compression garments, right? Doing our lymphatic massage, following through with PT, OT, different therapies. Body image concerns, procedural anxiety, whether that's surgeries. In kids, oftentimes we see a lot of procedural anxiety around lab work, right? And we all know that when we have a chronic health condition, we get more lab work than our counterparts, right? So procedural anxiety. Medical traumatic stress is a concept in the literature. There are many things that you'll hear me say throughout this presentation that I'll say we could have spent our entire 40 minutes talking just about this. And medical traumatic stress is one of those things. So we talk about post-traumatic stress often, especially within kind of the veteran literature, right? Medical traumatic stress is along the same lines, although there is lots of research being done right now on what the impact of repeated medical procedures, repeated doctor's appointments, has on patients and families, right? I have a patient right now who I am treating, who every time they get within a mile of the hospital, this young woman starts to feel really panicky and really anxiety-ridden. That could be whether they're coming for a doctor's appointment, whether they're coming for a specialty completely not related to her chronic condition, or whether they're coming for surgery. It doesn't matter, right? But kind of the impact of those repeated medical experiences and what impact that has had on her. Medical decision making, so whether that means starting or trialing a new medication, family team communication, and then pain. And again, we'll talk a little bit more about pain. Like Melanie said, again, this is something that we can talk about for not just the whole 40 minutes, but hours and hours and hours on end. And I know this is something that she's crusading to really get kind of a multidisciplinary panel together to address, because it is such an issue within this condition, is both acute and chronic pain. So I want to go back to this. So those are kind of the major differences between clinical psychology and then pediatric or health. So it's really important to know that when you're looking for a provider, right? So whether that is a provider within the hospital or the clinic that you're attend, or whether you're looking for somebody in the community, it's really important to know that there are psychologists and therapists who have had specific training in both acute and chronic illness. Yes?
So as an adult, when you're searching for psychologists, you look for a pediatric psychologist?
So you could look for a pediatric psychologist. You could also look for someone. I would just make sure that under their specializations, they specialize in health. So I am a big believer, and I practice from what we call a family systems perspective, right? So if I had $1 or a quarter even for every time I said to patients and families, yes, Billy is the one diagnosed with this condition, however, this is a family journey, right? If I had a small amount of money for every time I said that, I would not have to work. And it's very, very, very true, right? So yes, it's the patient that brings us in the door, but it impacts our family in both ways of being difficult as well as strengths, right? And again, we're going to talk more about that. So all members are impacted in different ways, right? So I could be the wife of someone with KT. I could be the mother, I could be the sister, I could be the best friend, right? And we're gonna have our own perspectives and our own perceptions of things, but it's important to acknowledge that. Developmental considerations. So the point I really want to make here is that patients with a chronic medical condition have the exact same developmental needs as every other person on this earth, right? And I fear that sometimes we get so focused upon sort of what is different about us or what might be impairing about us that we skip over some of the developmental considerations that we should really keep in mind, right? One of the things that I talk about a lot is this whole concept of identity, right? So here I am, I'm, right here in the middle, I'm Aimee Thompson. I'm a wife, I'm a psychologist, I'm a friend, I'm a daughter. I could be someone diagnosed with a chronic medical condition. If I put all of my attention and all of my stock into just one of those branches, it's not sustainable, right? So we have to make sure that we are really cultivating and watering sort of all of those branches and all of those seeds within our identity. So developmental considerations, independence versus dependence. That's something that is really, really pertinent to this population. Because of functional difficulties, sometimes we have to be more dependent than we would like to be on other people, right? Whether that's related to ambulation or functional difficulties, sometimes we have to be a little more dependent. And that can be a big source of frustration and something that we can really work through, kind of determining, okay, so maybe you can't be at this point, right? Maybe it's difficult for you to be independent in this area. However, here's what you can do, and let's really cultivate these and capitalize on your strengths. Sexuality, right? Often talking about an elephant in the room, right? Often we don't talk about sexuality. We don't give attention to sexuality in people with chronic medical conditions, but they need the same proactive care, the same education regarding contraception, the same education regarding sexual function in general, as far as positioning, movement, balance, all of those things, right? And again, this is something I could have really spelled off on, we could have talked a lot about. However, I wasn't sure of the age of children in the room, so I didn't really want to go there. But it is something that is very pertinent, and I think it's really, really, really important that we think about and talk about. Social involvement, we'll talk a little bit more about that and how important that is in our overall kind of coping and adjustment. Academic development and vocational planning. So if you all remember, right, on one of those first slides that I showed from 2014, one of the things that were on there was kind of difficulties with finding a job that was appropriate, right? Whether that was due to pain, whether that was due to the need to sit down or elevate our leg, right? But really sort of thinking about those things. So we've sort of already gone over this. So the impact of physical changes as a result of vascular anomalies, so changes in functioning. Again, whether that's ambulation or functioning in general, our ability to engage in daily activities that we want to be doing, not having to depend on other people. Social perception, what are other people thinking, right? Am I feeling self-conscious? Am I worrying about people looking at me or what they're seeing or if they have questions, right? I had a conversation just about 15 minutes ago, right? That coming into this room is like seeing your people, right? Coming into this room and seeing other people that have the same or similar medical condition as you, right? And just how affirming that is, but also how overwhelming that can be, right? Especially if you're feeling pretty isolated. That's the difficulty with vascular anomalies, right? Is that there's so much variability in them, but they're also not a super common condition, right? So it's not really easy to be walking down the street and find someone else who has the same condition as you, right? So it's hard to get that inclusiveness. So that's why events like these are so, so, so important. And just, putting in a plug, I would encourage you all to continue to be actively involved in this group and attend these meetings because the benefits are just enormous, whether you're a family member or whether you're a patient. Self-esteem, and then again, sexuality. So pain. I limited myself to one slide on pain. It was very difficult, but I did it because that is not what this talk is completely about. Physical pain and the emotional impact, right? So again, really, really, really looking at that combination between our mind and our body. My physical body is hurting, but what toll is that taking on me emotionally? My frustration is higher, my anxiety is higher, my mood might dip, right? Even if I don't reach, a clinical depression, I might really be struggling because I'm just tired of being in pain, right? We know that there is a significant impact of pain avoidance, right? So when we're scared of doing something that's going to cause pain, when we are scared of engaging in everyday life because it may be more painful or because I'm going to experience pain, we know that these things are a prominent risk factor for pain-related maladjustment, right? Pain acceptance is negatively associated, so meaning as our acceptance goes up, our negative mood goes down, our functional impairment goes down, and our pain intensity goes down, right? Now, please don't mistake me by saying, oh, we just need to accept it and move forward, right? Because that is not true. Pain is very, very real, and that's something I want you all to hear. Your pain, whether it's chronic or acute, your pain is very, very real, and it's important that we address it, right? Our goal of intervention is improved functioning, right, and coping. So yes, from a physiological standpoint, we certainly want to manage our pain and we want to address it, whether that's pharmacologically or with different sorts of medical intervention, right? But we also really want to focus on our functioning and our coping overall. We do have evidence-based psychological interventions, and that's another thing that I would really like to kind of bring home. Good pain management goes beyond medical, right? Good pain management includes complementary techniques, whether that is lymphatic, whether that is psychological, looking at diet, nutrition, exercise, PT, OT, all of these things, right? Pain management is not just simply taking a medication. Is that important? Yes, it is important. I'm not saying that it's not. But I really, really encourage you all, again, to kind of put on that psychosocial hat of yours and think about what are some other things that I could be doing that could be enhancing the way that I'm feeling, both physically and emotionally, right? So from a psychological perspective, there's something called biofeedback. These are people that are very specifically trained in interventions that look at our physiological responses and give us feedback in a way that we can view and we can measure, right? So whether that is sensors set on, we have them on our finger, on our head, measuring our heart rate, measuring our muscle tension, right? It's giving us feedback on what our body does when we are in pain, as well as how our body responds when we're using kind of relaxation and different pain coping mechanisms. And it's been wildly effective. In research, we have data to show how effective biofeedback can be in pain management. Cognitive behavioral therapy is also an intervention for pain from a psychological perspective, as well as activity pacing and scheduling, right? So I don't know about you all, but when you're experiencing chronically persistent pain, the last thing that you want to do is to get up and do something fun, right? Because you are not in the mood, you are just kind of feeling down, you're feeling discouraged, you're feeling frustrated, right? So one of the things as a psychologist that we really talk about a lot is we can't go from this end of the continuum to this end of the continuum overnight, right? We're not going to go from being completely debilitated mentally and physically from our pain to being up and out, moving around all day long, right? So we are going to pace our activities. We're going to set very, very, very small goals. And we're going to be kind to ourselves, right? So just because we could, run 3 miles before, maybe we've had a change in our condition or we've had an increase in our pain, maybe now we can do half a mile, right? And you know what, for today, that's okay. We're going to keep moving forward. We're going to keep making small steps, right? The importance is that we're moving forward. We're going to where we want to be. We don't have to jump to be there right now, right? Some of the things I talk to people about that struggle with chronic pain are really, really simple things, right? Let's start small. Get out of your pajamas every day, right? If you are at home and it is a day that you're not working or you don't have school, I don't know about you all, but if I stay in my pajamas on my couch under a blanket, sure, it might feel good at first, right? But eventually you get into this rut, right? And it's like the more we do it, the more we do it, the more we do it, the harder it is to pull out of it, right? So don't get me wrong, I am someone that enjoys a lazy day every once in a while. In fact, Monday I am not working and that's going to be my day on Monday, right? However, get out of your pajamas, even if it's to put on other comfy clothes, right? Open your blinds, right? Get out of bed. If you're going to watch a movie, sit on the couch, right? Get out of bed. And I also really encourage people to get fresh air every day, assuming the weather is cooperating, right? Even if that means sitting on your front porch and making your phone call or playing your phone or, reading your book, get outside and get some fresh air, right? So those things are important too. And those are little changes that we can all make, right? We can all commit to those things. So this was really, really important for both the patients, but especially the families and the caregivers that are in the room. And I want to say as well that caregivers, when I say caregivers, I'm not just speaking of parents. I'm speaking of spouses, I'm speaking of partners, I'm speaking of any person that is in the life of the patient who is highly involved in their care and their well-being, right? So who are we getting our input from? Often we look at caregivers to provide feedback. There have been a number of studies recently that have shown us that this might not be the best way to go, right? So one study showed that radiographic and physical measures of appearance did not correlate with patients and caregivers' perceptions of appearance. Patients and caregivers rated their appearance higher following surgery than kind of our physical measures and our radiographic data. Patients and caregivers did not strongly agree on the outcome of surgical intervention. Patients felt that their goals had been met more than parents and caregivers did. Quality of life scores found to be higher than healthy peers, physicians, and caregivers expected, right? So when we looked at quality of life, patients were rating it higher than their caregivers, their physicians, or their healthy peers expected, right? So, someone made a comment to me earlier today about really switching from the, thought of, oh, poor me, to let's move forward, let's look at who I am, right? Beyond my KT, including my KT in my identity, right? But what else do I have to offer this world? And so this slide really, really looks at what we are moving to within psychology from a deficit to a strength conceptualization, right? So when we look at deficits, we look at what's broken, right? What needs to be fixed, fixing our weaknesses, and it's based on prediction and control, right? I don't know about all of you in the room. If I could predict and control everything that happens in my life, I would be a happy, happy woman, right? But we know that that is not the case, especially not with chronic illness, right? We cannot predict when we're going to have a flare-up. We cannot predict when we're going to have a bad pain day, right? Prediction and control are something we have to learn to be able to relinquish, right? And that's a hard thing. And it also looks at external locus of control, right? So looking at that deficit model, we're looking at things are happening to me, right? Things are happening to me, this is outside of me, I can't change it, right? I can't change it all, I can't adapt to this. All of these things on the outside are coming at me. Moving more towards a strength conceptualization, right? It's based around the capacity to adapt and to change. It's looking at resilience. It's looking at both individual and family level strengths. Emphasis on kind of possibilities, right? And it's looking at an internal locus of control. So yes, these things are happening outside of me, but what do I have inside of me that can address them? How can I tackle them head on, right? What can I control? I can't control a lot, but what can I control? And let's focus on that. So it really goes into resilience and family hardiness, right? So an emphasis on how do we cope in healthy ways, right? So I always say to people, I may not be able to change or remove or fix what is going on with you, right? But what I can do is I can walk alongside of you and we can work together, we can work collaboratively to make things the best that they can be in this moment, right? Because everyone in this room, whether you are a patient or a family, deserves to live a life that you are proud of and that you feel productive in, right? So we know that resilience and family hardiness is a buffer against the negative outcomes associated with chronic illness. We also know that an increase in resiliency scores is correlated with a decreased chance of both internalizing and externalizing behavior concerns, right? So internalizing concerns being your things like depression, anxiety, adjustment concerns, externalizing concerns being your more external behaviors, right? Whether that's a young kid acting up in school or daycare, or out in the community, not listening at home, being really oppositional and disruptive, right? So taking control of their lives, right? That's what resiliency is all about. Again, we might not be able to fix it, change it, remove it, but what we can do is we can take control of what we can, and we can move forward and make this life ours, right? Developing a sense of well-being through an ongoing process of acceptance and growth. Optimism is a unique predictor of quality of life. And again, going back to pain, we see that resilience is really strongly correlated with pain acceptance, that concept of pain acceptance that we talked a little bit about before. So what did caregivers say supported their coping? And that was the support from families, right? What did they say increased their stress? So families of patients. Negative interactions with their medical team, and not knowing or feeling like they are not equipped to help their child live with their needs, their medical needs, right? So those were the two main things that people reported were increasing stress. And again, looking at that family systems perspective, right? Kind of an alteration or a stress in one level is going to shift all of us, right? So, may influence caregivers' anxiety when their child is in the hospital or receiving ongoing treatment for the chronic condition. Concepts relevant in adolescence, so peer relationships, right? We know that peer relationships are a buffer against many, 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 many things, right? So the importance of peer relationships cannot be understated. Family support, school attendance, and self-esteem. Increased social networks. When we have resiliency and family hardiness, our social networks tend to be larger, decrease our stress. And then there was a really interesting study done where 4 themes emerged from patients and families with chronic illness looking at this resiliency piece. So they basically were giving them some objective measures and using some qualitative interviews to look at what does resiliency and family hardiness mean to you, right? If we're saying that these concepts are something that are really going to help us, help our family, help us as patients grow, How do we do that, right? And the 4 themes that emerged were education, seeking support, creative problem solving, and living for today, right? And if there are 4 things that I hope that you all take from this conversation or this presentation, I would really, really, really like for it to be this, because these 4 things are so important. No matter what age the patient is, no matter where you are on this chronic illness journey, right? It really is looking at how can we grow these things within ourselves and within our family. So, education. Educating others about the illness or the condition, right? So again, if I'm not around my people, right? I'm not around my people that have a similar condition than I do, how do I educate people around what that is and what that means? Education also includes talking about the impact that it has on the family, right? How is our family different? What do we do to support the patient? And how do we sort of function as a family? Support, asking other people for help, whether that is a professional or whether that is spiritual, whether that is a friend, right? And I want to, point out that support or help does not have to be simply emotional. The power of someone stepping in to help with tasks is immeasurable, right? Say I am at a hospital and I had an unexpected hospitalization. My husband is trying to juggle myself and the children or work demands, right? Someone stopping on the way home at the grocery to pick up a few things we need is huge, right? Somebody offering to bring over dinner, huge. So thinking about support in many different ways, professional support and personal support, whether that's acts or whether that's emotional support. Creative problem solving, so setting priorities and simplifying our life, right? So what is important to us as individuals? What is important to us as a family, right? And how do we make those things the center of our being and move forward? How do we simplify our life? Is it really important to get X, Y, and Z done today? Or if I get X done, is that good enough, right? Simplifying our life and really focusing on what our priorities are. And finally, living for today. So living day by day. How many of you all have had a plan changed or weren't able to do something you wanted to do because of an unexpected event with your condition? Right. Frustrating, right? And how the quicker that we can really start to look at things day by day and adapt that flexibility, right? Because again, we don't have control over everything. We don't know what we're going to feel like tomorrow, what we're going to feel like tonight, right? And so really being kind to ourselves and allowing ourselves to have that flexibility in planning is really, really important. So I wanted to finish with a couple of case examples just to sort of bring this into, okay, Aimee, you talked about all of these things, but what does this actually look like in real life, right? So of course names will change. But Sarah is a 6-year-old female. She has extensive overgrowth of her lower extremity. When they came to me, presenting concerns were medical anxiety, parental worry about Sarah starting kindergarten in the fall. So what were people going to say? How do I talk to the teacher about it? Are kids going to look at her? How do I prepare Sarah for going into this new environment with kids that may not know kind of what's going on with her, right? Body image, social inclusion, and developmental considerations. So modes of intervention. So from a medical anxiety standpoint, really working with Sarah, she had a lot of, again, procedural anxiety around needles, so lab work essentially, right? So we worked really hard to come up with a plan that she could use at the times when she was coming in for lab draws to give her some control, right? So things like, do you want the nurse to count to 3 or not? Do you want to be sitting down or laying down? Do you want to be holding mom's hand or dad's hand? I had a little girl who, not this little girl, but another little girl, she wanted a pillow under her back, she wanted to be laying down, she wanted her feet propped up, she wanted the nurse to count to 3, she wanted to be holding her mom's hand, and she wanted to be listening to Let It Go, right? Okay, we'll do it, right? If that's what it's gonna take to decrease this little girl's anxiety, we're gonna do it, right? And part of that is a benefit of working in a children's hospital, right, is that we can do some of these creative things and people don't give us as much, griping about it. However, I would encourage all of you, whatever institution you are at and whatever setting you find yourself in, really advocate for yourselves, right? I'm assuming the adult patients in here are not going to want Let It Go playing. However, if there is something that is going to reduce your anxiety, do it. Right? Advocate for yourself. Do not be afraid to ask, right? Do it. Parental worry. So just like we talked about in another slide, what I found was that parents were much more nervous about what other people were going to think about Sarah than Sarah was, right? So really talking to parents, also to her, but talking to parents as well to develop a script on what might we say if somebody says something to us, right? If a kid asks us, hey, why is your leg big? Or, hey, why do you walk kind of funny? Giving Sarah a script to respond to that so that she's not caught off guard, right? Also giving parents a script on how to talk to the teachers to sort of prepare them and give them information that they might need. And then developmental considerations. Sarah was also someone who wore compression and some wrapping. And so although she was 6, potty training was still pretty difficult, right? She was, for the most part, potty trained, but still had accents because she couldn't get some of those things off quickly enough. As those of us who either have 6-year-olds or no 6-year-olds, sometimes when the urge strikes, they gotta go now, right? And so to get off a compression garment or some wrapping was really difficult. So behaviorally working with the parents on making a plan and working with Sarah on a plan for that to reduce accidents. And then on the other end is a 36-year-old male, John, right? Extensive involvement in the pelvis and the lower extremity. Presenting concerns were adjustment post-amputation and role in family. So John and his wife had decided to conceive, and so not only speaking sexually prior to conception as to what that would look like, but also post-conception, what is John's role going to be as a father, right? He had some extensive involvement and ended up having an amputation, so he was worried about things like carrying the baby around, right? He was worried about, am I going to be able to get up in the middle of the night if I hear the baby crying and get to her fast enough, right? And what does that mean about me as a man if I'm not able to do those things? So really, again, focusing on strengths. Okay, maybe you can't carry the baby around, but what can you do? Can your wife bring her? That doesn't mean you're getting out of the poopy diapers, right? Does that mean that your wife can bring her to you and lay her on the couch and you can change the diapers? Can we have things down on the lower floor so we're not having to worry about ambulating stairs, right? Yes, maybe it's difficult for you at this point because you're not used to your prosthetic in walking upstairs and downstairs to the laundry room, but can we have the laundry basket brought downstairs and you can fold them down there and your wife can take them upstairs, right? So really thinking about those things. And again, modes of intervention. So CBT is cognitive behavioral therapy, for those of you that don't know. And ACT is another mode of therapy. It's acceptance and commitment therapy. So again, really focusing on that strengths perspective. How do we tolerate the distress that we have inside of us and move forward and integrate that into who we are? And then also important to note is the inclusion of John's partner, right? Because again, this is a family journey, and so to not include her and not have her come to a few of our sessions would just have been poor practice on my part, right? So what are we doing to advance the literature in this area? For any of you that have done any sort of literature search, whether it's an official literature search or whether it is a Google literature search, right, of psychosocial considerations in vascular malformations, you will find minimal to none, right? Very frustrating, very, very frustrating. We are working very hard to change that, right? So we have a growing behavioral medicine presence in our clinic. As of a year ago, I was the only psychologist working in this clinic. Now, due to some staffing changes, there's also another psychologist that's working. So there is myself and another psychologist that's involved with the clinic at Cincinnati. We are currently doing a research project. So right now we're targeting all new visits to our multidisciplinary clinic. And all new visits are getting 3 measures, right? So they're getting a psychosocial assessment tool, which just goes over some potential stressors and things that could be impacting our functioning, an uncertainty scale, right? And then a brief symptom inventory, which looks at things like mood, anxiety. So we're getting these not only to build a large database of our patients, but also to really look at, my prediction is as uncertainty goes higher, right? Not only uncertainty about our condition, what it is, and what our, prognostically, what we look like long term, what complications might I face, our symptoms are going to increase as well, right? So we're looking at those things. We're tracking referral concerns so that we can develop a protocol around more targeted interventions. When should behavioral medicine be involved? As of right now, we do not meet every patient in clinic. It's a referral or a consult basis only, meaning that comes from our physicians or a family can request it. So really looking at what are the referral concerns coming in and how can we better target not only our initial interactions, but also our targeted therapies. And then we also have a summer camp that we do. So there's a week-long summer camp that is for hematology and oncology diagnosis, which our clinic is kind of wrapped down in. Kids go for a week, they sleep away. It's wonderful. I could go on and on about camp, but again, it's about being around people with chronic conditions, and the kids love it. First-timers often cry when they're being dropped off because they're scared, and then they're crying when they're being picked up because they have so much fun they don't want to leave, right? So that's wonderful. What's really great is this year, actually in September, we're going to have a family camp day just for our HVMC, or our vascular malformation population. It'll be a day camp where patients and families go, where we can really, have some fun, but also mix in the support aspect, the education aspect, and just get these kids around each other, right? Because it's very important. So again, stay involved in these organizations. It is absolutely invaluable. Yeah. So where does that leave me, right? And where does that leave you, is what I mean. And I guess I would say just continual self-evaluation. Whether you are a patient or whether you are a family member, right? Continually check in with yourself and see where you're at. How are you doing? What might I be struggling with? What might I be doing really well with? And know that that could change day by day, week by week, month by month, right? Not being afraid to ask for help, again, professionally or personally. But really just acknowledging this is a journey. There's going to be highs, there's going to be lows, and there's going to be plenty of times where we're just sailing through, right? And that's normal. But really honoring yourself and your life and how you can do what you want to do and live a fulfilled life. Lots of references, the boring stuff, right? And then my email address up here. For any questions, comments, or feedback, please don't feel shy about contacting me. And I will also be here the rest of the day. So I'll be here through the panel and the round table and all of that. So please feel free to kind of walk up and ask me anything.